Welcome to the video. My name is Jason. Together with my colleagues Sarah and Sienna, we are going to present some information about the influenza vaccine. We'll talk about a brief history of the flu vaccine, its properties and how it works, and its impact on society. First, an overview of its history. In the 1930s, a group of English scientists led by Dr. Wilson Smith first isolated the flu virus. This enabled them to describe the features of the virus, develop the vaccine using hen's eggs, and to successfully conduct clinical trials. In the 1940s, the inactivated influenza vaccine became widely available. By 2003, the live attenuated flu vaccine was approved. In 2011, the recombinant influenza vaccine, which uses no egg, became in use.
Properties of the influenza vaccine and how it works. Vaccines are either inactivated, meaning that they do not contain a live virus, or they contain a weakened live virus. There is no preference expressed from one vaccine to another according to the CDC. There are 3 influenza vaccines: quadrivalent inactivated influenza vaccine, recombinant influenza vaccine, and live attenuated vaccine. The quadrivalent inactivated influenza vaccine is manufactured by growing the virus using eggs or an animal cell. This is approved for ages 6 months and up, and the vaccine is injected into the arm. Recombinant influenza vaccine is an egg-free vaccine and is approved for those 18 years and older. The live attenuated vaccine is approved for ages 2 to 49 years old and is given intranasally. This live attenuated vaccine is not approved for those who are pregnant, immunocompromised, and some other groups. This vaccine contains a live virus, but it is weakened or attenuated, so it does not give you the flu. Once vaccinated, these inactivated viruses trigger the body's immune system to produce antibodies 2 weeks after vaccination. The specific viruses in an annual shot depend on which are likely to circulate during that year's flu season. The vaccine is widely accessible, and you can find it at your local school, supermarket, pharmacy, and hospital clinic.
What is the impact of the influenza vaccine on society? The virus first appeared in the spring of 1918. It started as a mild form, and by the end of the year, it had mutated into the deadly disease we know of today as H1N1. During this time in history, healthcare workers could not rely on the modern medicine we have access to today to treat sick patients. So the primary form of treatment relied on nursing care alone. No vaccine existed yet. Due to how widespread this pandemic had become, there was a shortage of nurses. Hospitals were at capacity, and temporary accommodations were made to treat the large number of sick individuals. Schools, churches, and warehouses were even converted into emergency treatment centers. However, today, modern medicine has given us a vaccine against this virus. This vaccine is very accessible to most people. Getting it can keep an individual from contracting the disease or lessen the severity if infected. The availability and success of this vaccine has greatly reduced the demand on healthcare workers and the system. Our question now to you is, why is it recommended to get a flu shot annually? A. When more people receive the vaccine, less flu outbreaks occur and the healthcare system does not become overwhelmed. B. The virus changes each year, therefore the vaccine is continuously changing. C. The vaccine is a quadrivalent vaccine that provides protection against the 4 most common strains of the seasonal flu. Or D. All of the above. The correct answer is all of the above. The rationales behind these answers were taken directly from the CDC website. A link will be provided at the end of this video if you have further questions. So A is correct because approximately 105,000 hospitalizations from influenza were avoided in 2019 and 2020 due to people receiving the vaccine. B is also correct because the CDC says the protection provided by a flu vaccine varies from season to season and depends in part on the age and health status of the person getting the vaccine and the similarity or match between the viruses in the vaccine and those in circulation. C is also correct. All influenza vaccines are quadrivalent, They protect against an influenza virus, H1N1, an influenza A, H3N2 virus, and 2 influenza B viruses.
Here is some data on the influenza vaccine. This is a map of the 2020 to 2021 flu vaccination rate for each state in the United States. There is a tie of 2 states of having the most vaccinations. Massachusetts had 66.5%, and Rhode Island was at 66.4%. California had a vaccination rate of 49.4%. Patient education on the influenza vaccine. The CDC recommends everyone 6 months and older to get vaccinated every flu season. Children 6 months through 8 years of age may need 2 doses during a single flu season, while everyone else will only need 1 dose. It is especially important for certain groups of people to receive the vaccine because they are at a higher risk for developing serious complications. These groups include people 65 years and older, those with chronic diseases such as asthma, lung disease, or diabetes. Pregnant women are those who may become pregnant or breastfeed during the flu season, and those who take care of people at high risk for serious complications from the flu. Common side effects from a flu shot include soreness, redness, and/or swelling where the shot was given, headache, fever, nausea, muscle aches, and fatigue. The flu shot, like other injections, can occasionally cause fainting.
To conclude, we'd also want to present the resources used for this video. If you find value in the information, please like and share. Thank you.